Hello, good evening. Welcome to the 21st Annual Rabbinic Conference of the PUAH Institute. PUAH Institute has been in existence for over 30 years, and we've had the pleasure of teaching, learning, and sharing with rabbis, representatives, and professionals all over the world. This evening, we have the opportunity to hear from some experts, both in the medical field and the halakhic field. Obviously, we're in a very difficult period at the time for the whole Jewish world, for the whole world, the time of COVID-19, of Corona. And we're going to hear this evening practical advice connected to Corona, to pregnancy, to nursing, to fertility, and of course the halakhic ramifications as well. PUAH Institute, based in Jerusalem, has offices all over the world, and we're going to hear also about what PUAH is able to achieve, and what we have achieved and will continue to achieve in America. We'll hear from Rabbi Siegelman, one of our esteemed rabbis based in New York. And we're going to hear also about cancer, cervical cancer, how we can prevent it. We're going to hear from an expert as well. The idea of the Rabbinic Conference is to share information. Baruch Hashem, who has been at the forefront of being able to bring together and to synthesize the incredible halakhic knowledge together with the cutting-edge medical knowledge, to bring it together and to be able to not only understand and comprehend and be able to share information, but also practically to be able to serve couples, to be able to answer questions, the myriad, thousands of questions that we've had over the years, and especially during this very, very complex time. Questions I think that no rabbi has ever been asked before, and we've been able to field these questions, to be in close contact with rabbanim, with doctors, with experts worldwide, in order to achieve a level of understanding and also a level of expertise that we're able to impart not only to the couples, but as we're going to do this evening, impart to you, rabbis, rebbezins, and professionals. You rabbis and rebbezins are at the forefront of your own community, being able to guide them with the questions that they have. There are many, many questions that will arise. Of course, in this short amount of time, we're not able to cover all of them. But you should know that PUAH Institute, both here in Israel and in America and worldwide, is available for you to turn to when you have a question. Things change. It's a dynamic field in which what may be true today may not be true tomorrow, may not be the truth in next year's conference. However, we are able to field your questions to help you to be able to guide your own communities, to be able to avail themselves of all of the latest medical technology within the most current and appropriate halachic guidance, and in order to help the Jewish people and to help your own community. With no further ado, we'll start this important session of the conference. We've had conferences, we say, for over 20 years. However, this is the first year that we've had a special session that's dedicated in English. We also have a session in French and in Spanish to understand a bit of the international nature of PUAH. And this is the first time we've had it in English proper. And so we're extremely excited, extremely proud what we're able to share with you. And we hope that you will benefit, you will gain from every word that is said, also in the Hebrew sessions, and specifically in this English session. Thank you very much. Good evening, and we should have, Bezrat Hashem, a very successful and wonderful session and a whole conference. Thank you very much.
Rabbi Herschel Schachter needs no introduction. One of the most important poskim, one of the great thinkers, and someone who has guided the Jewish people throughout this very difficult period, this period of COVID-19. Herschel Schachter was one of the youngest Rosh Yeshiva appointed to Yeshiva University. He's a posek for the OU. He sits and guides many, many rabbinic councils, organizations, and also many, many young rabbis. Many, many people around the world have received smicha and guidance from Rav Herschel Schachter. Over the past few months, Rav Schachter has presented every so often guidance as we lead up to Chagim, questions that are related to how should communities continue to function, also related to using a mikveh, and other questions that have a bearing on what we are speaking about this evening. But at PUAH, we have a very special relationship with Rav Herschel Schachter. Rav Schachter is always available for us, for the rabbis here, to be able to field our questions, to give us some guidance, and to act as a mentor when we have difficult questions, to know that Rav Schachter is available for the rabbis in America and also for the rabbis here in PUAH when Rav Schachter comes to visit. It is our honor and our pleasure to hear Divrei Bracha from Moreinu Rav Hershel Schechter.
My name is Rabbi Hershel Schechter. I'm connected with Yeshiva University already for over 50 years. I'm very familiar with PUAH for quite a few years. I used to participate in the annual Kenes they have. The organization is a very important one. It's an institution. They help people out who have fertility problems. Many people, not only in Eretz Yisrael, many people in America, many people all over the world are helped by the PUAH organization, and they certainly deserve our support, and all of their publications are extremely valuable. I have almost all of them at home. I wish them much hatzlacha on this year's most difficult kenes. It should be beroiv hatzlacha.
Good evening. As we said in our introduction, the corona and the period of the COVID-19 has raised tremendous number of questions, both halachic, which we'll hear a little later, and of course medical. One of the questions that we have been faced in recent times is the whole question of using the vaccination. How safe is the vaccination for pregnant women, for nursing women, for women who are undergoing fertility treatment? How will COVID-19 impact fertility, impact gynecology? And so these questions we have been faced and we're dealing with in the past few weeks as the vaccination around the world has become more available. And this evening we're going to hear from an expert in the area of fertility. Professor Hananel Holzer is the director of the IVF department an associate director of the Division of Obstetrics and Gynecology and Hadassah Medical Association. Professor Holzer has a very eminent past in which he has been, among other things, also was a director in McGill University in Canada for many years, in which he developed also the fellowship program there, and also was involved in many committees throughout Ontario, throughout PUAH, in the whole question related to the fertility. And he has, since coming back to Israel, has been a very major force in developing fertility treatments and fertility departments throughout Israel. And it's our honor and our pleasure to hear this stuff this evening from Professor Holzer, who's going to address us on the question of use of the vaccine and the impact on fertility. Professor Holzer, thank you.
Thank you very much, Rabbi Weizmann. It's a pleasure to be here and also to speak with such an eminent audience. As Rabbi Weizmann has said, I was born and raised in Israel. I did my medical studies at the Hebrew University, my residency here at Hadassah. Then we moved to Montreal for a one-year period that actually lasted for more than 10 years, where I ran the fellowship program and the McGill Reproductive Center. Then I went back home to Israel, to my alma mater. I'm currently at Hadassah. And I must say again that I do enjoy working with the PUAH Institute and its rabbis. I was asked to say a few words about the COVID-19 vaccine associated with fertility, pregnancy, and lactation. It's not the usual scope of talks that I give. Usually it's about fertility, about PCO, fertility preservation, male fertility, but this was an offer I couldn't refuse that was given to me by PUAH, a very interesting topic, and I must say that around 3 or 4 times an hour, I get questions from patients, from rabbis, and for advisors. So according to the WHO, before, during, and after childbirth, all women have the right to high quality care, and includes the antenatal, intrapartum, the newborn, postnatal, and mental health. What about COVID-19 and pregnancy? We know that the body undergoes modulations during pregnancy. For instance, the maternal immune system in pregnancy, it may affect the response to infections and specifically to viruses. There are also changes in lung physiology, the lung capacity, and the ability to clear secretions. We know that COVID-19 is associated with high rates of thromboembolic complications, and we know that pregnancy is a hypercoagulable state on its own. So pregnant women with COVID-19 may have additive or even synergistic risk factors for thrombosis. There have been reports concerning COVID and pregnancy. Some are reassuring, some are less reassuring. Some reports say that there is no increased risk of miscarriage. Some other reports said the opposite. We know that in early pregnancy, there is little evidence about the possible impact. But we know from seasonal regular influenza has been associated with high rates of miscarriages, with high pyrexia, high fever. The perinatal outcome of pregnant women infected with COVID-19 are currently not yet well established. Some reassuring data. On the other hand, some adverse neonatal outcomes like preterm delivery, respiratory morbidity, thrombocytopenia, liver injury, and even, God forbid, mortality. There's an interesting study that was conducted in 7 centers in Israel, led by Hadassah. Amichai Rothenstreich is one of our brilliant residents. Unfortunately, he's not going to sub-specialize in REI, but in MFM, unfortunately for us, at the fertility unit. So this was published recently. Actually prospective study of women who were diagnosed with COVID and gave birth in 7 centers in Israel. The reasons for COVID testing were either routine screening. At Hadassah, we do universal screening for all childbirthing women who come to the birthing center, but it's not a universal test done in all of the Israeli hospitals. So some were analyzed because of routine testing or routine screening, and some because of symptoms that we see over here. We know that around 1/3 of these delivering women gave birth before the 37th week, and almost 20% before the 34th week. They had higher rate of gestational diabetes mellitus and some hypertensive disorders, higher than the usual population. There were some complications. Surprisingly, not so surprisingly, we're happy to see that none of the children were diagnosed with COVID-19. So the conclusions of this study that was published recently, that in COVID-19 affected mothers, vaginal delivery rates were higher than were published before, and associated with favorable outcomes with no cases of neonatal COVID-19. And the findings underscore delivery management among infected mothers should be based on obstetric indications and may potentially reduce the high rates of cesarean delivery previously reported in this setting. The rates of cesarean delivery in this study were 25%. They're still higher than what we have here in Israel, but much lower than reported before. What about around the world? We know that symptomatic pregnant patients, I emphasize, pregnant patients with COVID-19 are at increased risk for more severe illness compared with their non-pregnant peers. There is a higher risk of ICU admissions, usage of ECMO, even death reported in pregnant women, if you compare them to non-pregnant peers in the same age. We know that pregnant patients with comorbidities such as obesity, I must say it's obesity of the patient, not of the physician, and diabetes, maybe at even higher risk of severe illness, which it is consistent with the general population with similar morbidities. The CDC, Center for Disease Control, consider pregnancy a factor that leads to increased risk for severe COVID illness. That's why pregnant women may be at increased risk for severe illness, and pregnant women and their families should take steps to stay healthy and reduce their risk for getting COVID-19. I would say it's a good advice for all the population. A few words about the vaccine. With thank you, Dr. and Michal Stein from the Infectious Disease Infection Prevention Unit at Hillel Yaffa Medical Center. So we know about RNA for almost 60 years. We know that the DNA encodes for protein production. This is transcripted to RNA that leaves the nucleus of the cell as messenger RNA, and then the little factories in the cell, the ribosomes or ribosomes, produce the protein. So we know about RNA. When I was a medical student or in high school, we learned about RNA and messenger RNA. This is a timeline since the discovery of messenger RNA, the first human test of a personal messenger RNA cancer vaccine that was done 3 years ago, and the conduction of phase 1 clinical trial of the vaccine with messenger RNA. What is the vaccine? Actually, it's messenger RNA encapsulated by a lipid nanoparticle membrane for delivery into the host cell. That's the way it looks. And this messenger RNA with its lipid membrane enters, it facilitates the entry to the cell, the host cell. We know that's how usually viruses work. They enter the cells and they start multiplying. They have the ribosomes, the cell working for them to replicate and produce thousands of viruses. The vaccine, we only have the part that encodes for the spike protein of the COVID virus. The vaccine delivers the messenger RNA into the cells near the injection site. The lipid coating helps to bind the vaccine to the cell membrane and facilitating the entry into the cell. Then it uses the factory of the cell, not in the nucleus, to produce and replicate the coronavirus spike protein, not the whole virus, just the spike protein itself. The body replicates it, and then it's secreted to the lymph nodes, to the blood and the lymph system. There, it activates the immune system to fight against these spike proteins, hence to fight against the viruses. So this is a drawing. You see the vaccine, it enters from here to the cells, starts producing the spike protein. And then it's secreted outside and activates in a few pathways the immune system to fight the virus. So it's not a whole virus that is injected. It's not a live or even dead virus. It's only the messenger RNA encoding for the spike protein. Then we know about the Pfizer and other companies, the clinical trials that were presented last month to the FDA. This is a very famous study published in the New England Journal of Medicine last month and was presented to the FDA. They were looking at participants at high risk for acquiring the COVID-19, patients with medical history of COVID-19, immunosuppressive patients, immunocompromised conditions were excluded, pregnant women were not included. Then the people were randomized to receive either 2 doses of the vaccine. This is the code of the vaccine. Actually, they had 2 molecules, B1 and B2. B2 was more efficient, and they got 2 doses 21 days apart, and they looked at the safety and efficacy of the vaccine. The primary endpoint was the incidence per 100 person years. It's a way to measure. It's not that we're going to wait 1,000 years, but it means the time that each person is contributing to the trial is calculated, and the rate is per 1,000 person years. The first primary endpoint was to participants without serological or virological evidence of past infection. And the second primary endpoint was this incidence of people with and without evidence of past infection. The secondary endpoint was the efficacy against severe COVID-19 disease. This is a little bit about the demographics between the vaccine group and the placebo group. How efficient was this study? We see here that the first primary endpoint with the vaccine group, only 8 cases of COVID, with the placebo, 162, so the efficiency was around 95%. For people who also were included that had evidence of past infection, it was similar to that. By age, we see that it ranges between 93% the efficacy to almost 100% in this study. Gender analysis was a little different. With male, it was more efficient than with females, but it was a minor difference. Also looking at the differences between patients at risk for severe disease, like patients with heart disease, with diabetes, etc. And this is the efficacy of the vaccine after the first dose. We see here, this is the blue line, is the patients who got the placebo, and this is the patients who got the first dose of the vaccine. See, it was already partly efficient. How safe it is. So these are the patients that will have a long-term follow-up. Local reactions are pain, redness, and swelling. We see these are the rates. So people do complain about local pain. I had the vaccine 2 weeks ago. It was not painful when we got it, only the day after. And we see the redness and swelling are much less common. Systemic fever, it's more common after the second dose with certain age groups. And we'll say a few words about the systemic fever if we give the vaccine to pregnant women, which is an issue that I'll address in a few slides, around an hour and a half from now. Fatigue by age group, we know that currently younger people suffer more from fatigue than older people. That's the millennials and the younger generation, but we see here the rate of mild, moderate, and severe fatigue. Headache, another side effect. And what is very interesting are the deaths that occurred in these 43,000 people enrolled in the study. There were 6 deaths, 2 in the vaccine group and 4 in the placebo group. Both cases in the vaccine group were over 55. One died from cardiac arrest 2 months after vaccination, and the other one from arteriosclerosis 3 days after vaccination. We don't think it's related to the vaccine. In the placebo group, 1 myocardial infarction, hemorrhagic stroke, and 2 unknown causes. What about anaphylaxis? Anaphylaxis warning that was issued by the UK authorities. It may cause allergic reaction. Why? Rarely, some individuals could be allergic to a part of the lipid nanoparticle known as the polyethylene glycol. By the way, we use a similar compound when we do egg freezing. So we see here, this is the allergogenic compound that may cause allergic reaction, but very rarely. So people who had a previous anaphylactic shock after vaccine should consider if to get or not the vaccine, and any people who had some allergic reactions should be observed in a medical facility after getting the vaccine. What about infertility? A lot of rumors. We know that people thought that there were some suggestions that the spike protein is similar to protein presented while implantation. It's true only in around, the similarity is around 1%. So the chance of this causing miscarriage or some other severe side effect is not more than the regular population. We should remember that the COVID-19 messenger RNA vaccines are not composed of live virus. I said it before, I'll say it again. They're not thought to cause an increased risk of infertility, first or second trimester loss, stillbirth, or congenital anomalies. This was published by the ASRM task force. So a few words about the vaccination. At the present time, mitigation strategies for controlling the pandemic continue to rely heavily on universal masking, physical distancing, limiting social interactions. That's why we do it through Zoom, this lecture, and frequent sanitizing measures like hand washing. It's very important to emphasize we should maintain these strategies. It's very important to still maintain we are not out of the woods yet. The ASRM task force does not recommend withholding the vaccine from patients who are planning to conceive, who are currently pregnant, and those who are lactating. Patients undergoing fertility treatment, and this had some changes in the last weeks, and pregnant patients should be encouraged to receive the vaccination based on their eligibility criteria. Recent studies have suggested that pregnancy is a risk factor, as we remember, for severe disease. That's why it's important to avoid the disease, to try to avoid it and get vaccinated. Of course, a shared decision-making model between patients and providers should be used. However, physicians should promote vaccination to patients, their communities, and the public. This is from the ASRM, the American Society for Reproductive Medicine. The Israeli unions have published similar guidelines. What about the American College of Obstetrics and Gynecology? They recommend that COVID-19 vaccines should not be withheld again from pregnant individuals who meet the criteria for vaccination based on the vaccination committee recommendations. The vaccine should be offered to lactating, the breastfeeding individuals, similar to their peers that are not breastfeeding. So it's not a contraindication. It should not be considered when you speak about the vaccine with patients who is breastfeeding. Of course, the individuals who are considering should have access to all available information. Why was this mayhem about pregnancy and fertility? Because, you know, the first group that was tested did not include pregnant women. So we cannot say it was studies and was declared safe. However, if we look logically at the mechanism of the vaccine, it should not be higher risk for patients who are planning to conceive or actually pregnant. We should remember that, again, that the mRNA vaccines are not live virus vaccines. They do not use an adjuvant to enhance the vaccine efficacy like other vaccines, and do not enter the nucleus. They do not alter the human DNA in the vaccine recipients. I got a call from one of my colleagues in Canada. She was contemplating whether to receive the vaccine, and she told me, I'm afraid to mess with my DNA. And I told her, look, go back to biology. Remember your studies. It does not affect the DNA. It does not enter the cell. It does not change the DNA. It's only a messenger RNA that enters the cells, make it work. It's less than what the virus actually does. So the vaccines cannot cause any genetic changes. A bit of naches to the Israeli people, sorry. This is information from yesterday. The vaccination doses administered per 100 people around the world. And we see this is US here, Alaska, Canada, well done. But look at this little small spike over here in the Middle East. We all know what the spike is. If you look at the doses administered per 100 people, Israel holds the world record, followed by Bahrain, United Kingdom, United States. I'm happy to say I think others are catching up. Even in absolute numbers, around the world, over 12 million doses have been administered. Look, Chinese people who, actually that's where everything originated from, United States, but look at the fourth place. Over 1 million doses were administered here in Israel. So, is everything now safe? Back to usual? Are we, as I said, out of the woods? Unfortunately not. If we conclude COVID-19 in 21, it's still a rapidly progressing pandemic. Safety measures are crucial. We cannot overemphasize that. Symptomatic pregnant patients with COVID-19 are at increased risk of a more severe disease. Vaccines, however, should not be withheld from pregnant individuals meeting the criteria, and of course from patients who are planning to conceive, lactating individuals. They may be consulted to get the vaccine. That's what I do, but on a case-to-case consultation between the physician and the patients, and I'm sure that the rabbis are getting many questions as we are, so it should be a shared decision-making. So thank you very much for this opportunity to speak with colleagues around the world.
Mr. Holzer, thank you very much for a fascinating and very comprehensive presentation of the concerns and I think also the solutions. It's very clear to us at PUAH, and with the ongoing discussions that we're having with medical professionals worldwide, including yourself and including others, that it's clear, I think, that your presentation is that there really is no danger. I would ask you, though, a couple of questions, if I may.
Of course.
The first question is, you discussed a lot about Israel, including there was actually a piece, even in the BBC, and the BBC has no great love for Israel, that said that Israel is the world leader in vaccination. But we know that there are different vaccinations around the world. With the talk that you just presented, it seems to be relevant for what's going on in Israel, and you mentioned also your colleagues in Canada, but would it also be appropriate, for example, the vaccinations being given in England? Maybe I can have a word about that.
Indeed, most of the information was based on the Pfizer vaccine that we have experienced and we have data. The Moderna is also a messenger RNA-based vaccine, but it's a little bit different. It was based on previous platform that was for Middle East SARS coronavirus. We can disseminate the information as we get it. For the messenger RNA vaccines, I feel quite comfortable with. Regarding the other vaccines, we'll have to see. I think it's a very elegant method to provide vaccine. It's much more elegant than giving a attenuated live virus and having a mild disease. Here we only use the protein of the spike. So actually it's very elegant. It seems to be very safe.
Thank you. Another question, and a question that we faced over the past few months, I'm sure you've had exactly the same question. People that are undergoing fertility or about to embark on fertility, or about to stop taking contraceptives and start getting pregnant, as you presented in your beginning of your talk, that there is an impact of COVID on pregnancy and on pregnant women. Would you advise them that it's possibly appropriate to wait for some time till embarking on fertility treatment or to embark on getting pregnant? Or do you think that today we can say that it's pretty safe?
I would say that last year, you probably remember in March, we had an embargo in April on fertility treatments because it was was unknown about where we are headed. I don't think that Corona is going to be I think the corona is going to be with us for some period now. And I think that deferring fertility treatments could be for some people too much, especially with people who are in the older age group, but even younger who plan fertility, huge, large families, as we all encourage. And unfortunately, fertility treatments are not ones that you get 100% success rate. So you might be meeting a lot of challenges. So with all the reservations that things are still unknown, we have the patients sign a waiver that they are aware that still things are unknown, but I do not encourage people to defer fertility treatments.
Thank you very much. And what I think that it's clear from your presentation, I think you enjoyed it as much as we did, the idea that it was a little bit different than just speaking about PCO and IVF, something a little bit more, something somewhat different than our regular conversations. I think what's important to stress is that the ongoing, as you mentioned as well, the ongoing relationship and conversation between rabbis and medical professionals will enable us to present to those who ask us, for our congregants or for our patients, to be able to present with them the most current and up-to-date and correct information to enable them to make decisions. So I thank you very much for sharing that this evening, and I'm sure that everybody watching was enlightened and was informed and will now be able to give a much more concise and exact answer when asked those questions. Thank you very much.
Thank you very much, and I have to tell you that I do enjoy working with the spiritual leaders, halachic leaders. It's a wonderful collaboration, and like Navi Amos said, so I think that walking hand in hand with the leadership of PUAH is a great thing, and I enjoy working with you guys, and keep on the good work.
Thank you very much, and to you. Thank you very much.
Everything that we've done and everything that we will do at Hadassah, we will do for you, Nurit, and for you, Avi, and for Ona and Morshi, and Salah, and for you, the Cohen family, the Berkowitz family, the Huri family, and the Tuberi family, and for all of you.
Good evening again. The COVID-19 pandemic has raised throughout the world many, many different questions, novel ideas, questions that nobody ever dealt with before. This has also affected, of course, the Frum Jewish world. The Orthodox world has faced halachic questions, halachic realities that were unknown before. This is related to life and death issues, and also the beginning of life issues. The whole area of Taharat HaMishpacha, of preserving the laws of family purity, of undergoing fertility treatment, of trying to navigate both the limitations that were set on us by the governments throughout the world, and because of COVID, and to still preserve the halakha. These are the questions that came to the PUAH Institute here in Jerusalem. And we were able to field thousands of such questions, thousands of such new realities that no one had really thought about before. We were guided by the poskim, of course, by our numerous questions that we raised to different poskim worldwide. We're able to guide and help couples to keep both the mitzvah of nishmaltem od nafshedechem, to be healthy, and also the mitzvah to follow the halakha, especially in the areas of family purity. This evening we have the privilege of hearing from Rabbi Lewis. Rabbi Lewis is one of the senior rabbanim in Machon PUAH, one of the important developers of halakha, disseminators of halakha. He's a rav in Efrat, and also for the past 15 years, one of the experts here in PUAH. And he's going to share with us some of the difficult questions that came to PUAH and some of the answers that we developed. Rabbi Lewis, thank you very much.
Thank you so much. Thank you. Evening. Let me just share the PowerPoint presentation I have here for you. Just a moment. Here we go. So again, a few of our COVID questions, as we call them, which arrived. This is only a small sample of the questions we got. Nevertheless, gives you a taste of the things we have to deal with and the halachic challenges which COVID brings with. So again, we've planned our wedding for 2 weeks from today. Lockdown is expected next week here in Israel. We're usually told a few days in advance, sometimes even longer, that lockdown is expected. So we need to have the wedding earlier, which again is a question for many, many couples. Yet chuppah, in this case it was Thursday, is on the 6th day of the Nikiyim, of the 7 clean days. Can that be done? In other words, can she go to mikveh on the 6th day was the question, or if there's any solution that we can come up with. And she added to the question, I know my period ended last Wednesday. As I've wiped myself and I was clean, does that help me? Can I rely on previous wipes that were clean as a hefsek tara and bedika? That's an interesting question which comes with COVID. Another example, wedding was planned for tomorrow. My mother is now in quarantine for 10 days. These things happen from today to tomorrow. And again, unplanned in advance. We are pushing the wedding off so she can attend, which makes a lot of sense. My mikveh is scheduled for tonight. What should we do? Does she carry on with the bedikot? Does the fact that it's extended, it's an extended time, does that mean she has to do bedikot again? Is dam chimud an issue here? I can't make it to the Rav to inspect my bedika. Can I send WhatsApp pictures? That's not a per se COVID question, but nevertheless, it's been enhanced during COVID. I am supposed to go into quarantine as my kid was exposed to COVID. Can I go to mikveh tonight? Because maybe she's not really in quarantine. She wasn't exposed. Is that okay to go to mikveh? Is that any risk of anyone? My husband has COVID, yet feeling well. Can I tell her Friday night, even though we won't be intimate because he's got COVID and she doesn't want to go into quarantine, but can't you go to mikveh? Is there Friday night tevilah when he's around, but nevertheless not allowed to be together? Is that something which is mutar? As we know that if he's not in town, she shouldn't go to mikveh on Friday night. I'm pregnant or nursing or planning a pregnancy or undergoing fertility treatment. Should I take the vaccination? This is, again, it started vaccinating here in Israel I think 2 weeks ago, a bit even less. And this is a question which comes up. Is that safe for pregnant women, nursing women, and planning a pregnancy and so on? Should we push off treatment so I can first be vaccinated? Is there a reason to do that? The mashgicha, the supervisor, is in quarantine. The mashgicha for fertility treatment. The lab, or in the case that the lab forbids any extra people in the lab. How can we undergo treatment without supervision? Either because the mashgicha isn't available or the labs, and that was the situation here in Israel at the beginning. They would not allow anyone else in the labs, and where PUAH had to put a lot of pressure to change that. But nevertheless, what do we do when supervision isn't at stake? I'm expecting any day, if I deliver on Shabbat, can my husband join me to the hospital, even though he can't come into delivery rooms with me? The reason the husband can join his wife is because she is in a PUAH nefesh situation, and the Yetuve Data to calm her down, he is allowed to come with. But if he can't enter, maybe he shouldn't be going with. A lockdown is expected tomorrow, and I was asked by the clinic to come in today to retrieve the eggs and to hand in a sperm sample. Nevertheless, mikveh is only tonight. Can a couple provide a sperm sample when she is not tahor? Is there a way to do that, as normally we would expect it to be through marital relations, which can't be at this case, with using a sterile condom? How do we provide a sperm sample? This again is not a COVID question per se, but has been enhanced due to the pandemic. Can we undergo fertility treatment on Shabbat? Not to lose this month due to the lockdown. And again, the labs have changed and modified days and treatment in order to fit with the health requirements. And again, that affects couples who undergo fertility treatment. My usual bodeket tahara has COVID, and I can't be tested to make sure that the bleeding I have comes from a different source and not uterine bleeding. Any ideas that we can find? These questions again come about as well. A mikveh night is Friday night, but the outdoor minyan is opposite my house. I can't be seen by all my male neighbors walking with wet hair and a bag towards the mikveh. It's a serious issue of tznius and a very uncomfortable situation that the woman has to be in. Can she go to mikveh earlier, maybe during the day? Lockdown starts at sunset. Can I tovel during the day? Which again, this happens in all those places where lockdown is during the nights. I'm a balanit, a mikveh lady. The regulations require 15 minutes between each lady. These are the regulations here in Israel, the Misad HaBriut, the Ministry of Health, in order to eliminate the chances of contamination. And she says we have 14 ladies coming in tonight. Can we start before sunset? Because if you can stick in 4 women an hour, if things work well, that means that that's going to be very late for many women. Can we start earlier? So again, obviously we won't be dealing with all questions. I'd like to deal with maybe 2 issues that we brought up, and to see what halacha has to say and how we deal with these kind of questions. So we'll deal with a tevilah during the day. Is that something which has halachic grounds? Because it looks, again, we know that lechatchila clearly, tevilah has to be during the night. That's what the Gemara says, and that's where we paskin, Shulchan Aruch. Nevertheless, if there's a need to, can we bring tevilah earlier? So the Gemara in Masechet Nida brings the following, that Rav Papa asks Abaye and Rava, since today we are all safek zavot, or just to recap, a zava can tovel during the day, a nida must tovel during the night. And we hold today everyone to be a zava. So if we're all, we treat all women as a zava, that means you can tovel during the day. So if that's the case, let all women today, after Rabbi Zera, who treat themselves as if they're zava in all cases, so they can tovel during the day like a normal zava can, as the Torah says. And the Gemara answers, no, mishum de Rabbi Shimon. Rabbi Shimon says otherwise. As he says, achar tithar, achar ma'aseh tithar. The pasuk says, achar ma'aseh tithar. In other words, the minute she goes to mikveh, she is tahor. Nevertheless, this is if she would not see any bleeding till the end of that day. Aval chamru chachamim asur la'asot ken. So even though when she tovels she's tahor, chachamim say she can't do so. Shema tavod lidei safek, because the situation may bring up a case that she tovels and maybe she will see afterwards, and therefore she can't do so. And the Rishonim debate on what can she do. Can't she go to mikvah at all? Or she can go to mikvah, but they can't have relations. Because again, according to Torah law, they can be together on the seventh day after Tevilah, during the day. So Chachamim say you shouldn't go to mikveh at all, or shouldn't have relations. So most halachic authorities hold that she should not even go to mikveh. So there's a rabbinic decree against toveling during the day, during the seventh day, and in any case, she should tovel at night. That's the way the Shulchan Aruch writes in Kuf Tzadi Zayin, in Yoredea, Asura litbol b'yom shvi'i. She can't tovel on the seventh day. And even if she waits till the 8th or 9th day, Eina yechola litbol b'yom, she shouldn't go to mikveh during the day. The reason is Srach Bita, we are afraid that her daughter would see she goes during the day, she would also go during the day, and she will go maybe on the 7th day, and maybe she'll bleed afterwards, and it will mean that she's been with her husband when she was really Zava or Nida, and there's this Chiyuv Karet. We don't want any mistakes, therefore a blanket rule will be that you only go to mikvah at night. The Gemara brings the following story, that Rav Idi in a place called Neresh allowed women to go to mikveh on the 8th day during the day. The reason is there were lions there, in the Paponaya there were thieves, in Pumbedita it was too cold, in Mechoza there were bandits. Nevertheless, there were all kinds of cases where women couldn't go to mikveh during the night. Therefore, they would go on the 8th day. So Ravidi and Ravacha Yaakov and Ravida all allowed women to go on the 8th day because at night they can't tovel. So it appears to be that in our case, women could go to mikvah on the 8th day. If she can't go to mikvah at night, let's say there's a lockdown and she can't come out of her home at night, so maybe she can tovel on the 8th day. The Shulchan Aruch says, Heicha deika onis, when there's a case that she can't tovel on the 7th day at night. Again, she's afraid to go at night. It's too cold. There are thieves, or they close down the city gates. Yechola litbol bashmini med ve'od yom. She can tovel on the 8th day during the day. Aval bashvi'i, nevertheless, on the 7th day, that is impossible. Lo titbol mi be'od yom. Afal gav deika ones. Even though there's no other solution, you don't tovel on the 7th day. The Bach, the Rabbi Yosirkis, the Babayit Chadash, brings an interesting twist to this. He brings the sugya and he says, you must say that we're talking about 7-day women on the 7th day. And nevertheless, if there's an onus, if they're under duress, if there's no other way but toveling during the day, they can. Bashvi'i yecholot litbol bayom avalo balayla. Ubazoka mara avia de altalat v'lai kotzer. Avia, who says that if a woman tovels on the 7th day because of the onus, because she can't do otherwise, the tevilah is valid. And it brings the agur in the name of the Maharash. Nevertheless, she can't allow herself without her husband know about that, lest they have relations during the day, and therefore she would meet her husband at night. But she can tovel during the day on the 7th day. Nevertheless, he says that even those who go on the 8th day should wait till telling their husbands till nightfall. The Chokhmat Adam quotes the Sidrei Tahara, and the Sidrei Tahara says that if a woman can't tovel on the 8th or the 9th, and she can tovel on the 7th, in that case she can tovel during the day, even though lechatchila she should again go to the 8th or 9th day. But if that can't be done, so she can go on the 7th day, bayom, during the day. That's the Sidrei Tahara. And he quotes furthermore, the Shem Avodat HaGershoni quotes that nevertheless, even if she had the option to tovel on the 8th day, it's not that the mikvahs are locked the 8th day. She could toivel on the 8th day. Nevertheless, she was told by the Rav she can go on the 7th day. In such case, ein mazchichin oto. That is tolerable. It's acceptable that if she goes on the 7th day, even if she can go on the 8th day. So that's a big opening to allow women to go on the 7th day. Obviously, there's an onus. She can't go 7th night. But 7th day is an option. And he adds something which, again, is very relevant for today. If she's embarrassed to walk down the road where everyone is davening Kabbalat Shabbat or regular Mariv or wherever the case may be, in such case, that's a good enough reason to go to mikveh on the 7th day during the day, says the Chayei Adam, Chochmat Adam. The Torah quotes Rabbeinu Tam, who says that by Yom Hashmini, on the 8th day, she can toivel before Shkia, and she could get home when when it's dark. And the Rashbam says that she has to wait for Tvilah till nightfall. And again, in order to be lenient, we have to be lenient like Rabbeinu Tam, and that's what the Aruch HaShulchan says. Aval midivrei Rabotenu b'alei HaTosfot mevoar. It's explained by the Tosafot that according to Rabbeinu Tam, gam bayom hashvi'i mutar. Even on the 7th day, before nightfall of the 7th day, if she toivels, this is a case of onus, a case that there's no other option. But if so that is the case, he brings the examples. In such case, we can rely on Rabbeinu Tam. She toivels during the day. She will meet her husband in intimacy only after nightfall, and that can be a good solution for COVID cases. What kind of honest? The Pirkei Teshuvah says the honest, the problem should be a problem of all women in town. If it's only her personal problem, then maybe that doesn't count. So if she has a minyan in front of her house, maybe that's not valid for a honest, for a case that qualifies going to mikvah during the day. But the Rambam brings a chola, even if she is sick, if she personally happens to be sick, and therefore she can't go, therefore that will be good enough reason to tovel during the day. Bottom line, as we can see, the pshat, simple case, the simple halacha would be, like the Shulchan Aruch says, we don't tovel on the 7th day, not even the 8th day. There's an honest, there's a great need, so we can lenient on the 8th day. There's a very great need, so we can rely sometimes on those opinions. We'd allow even to go to mikvah on the 7th day before Shkia, before sunset. Nevertheless, they have to meet each other only after sunset. And again, the Rav would have to paskin in each case individually whether it qualifies or does not qualify the permission to tovel on the 7th day. I want to deal with one more case with the last 4 minutes we have left. Again, a woman had checked herself for the hefsek Tara. Usually the case would be, again, this question came about with many kalot. She's done the hefsek Tara, but suddenly for lockdown reasons, they have to bring their wedding earlier, and she knows she was clean beforehand because she's wiped herself and she's clean. Is that valid for a hefsek Tara? And we can count from then, or only from when she's on hefsek Tara, and then the mikvah, there's no way, the wedding would have to be a chupat nida, because we obviously can't bring down 7 days into 6 days or any less. So again, Shulchan Aruch says, bedika has to be chorimus dakim, and a bigger internal bedika, velo shetachniseu me'at likaneach atzma, a wipe, an external wipe is no good. And so says the Rema, it has to be ba'omek heitev kefi kocha. It has to be as deep as she can, even if it's not as deep as the shamash, as where the husband will get to during relations. Even if it's not at the deepest place, nevertheless, if that's what she can get to, that's enough. But kefi kocha, as she can, is a requirement of Shulchan Aruch and Rema, and it appears to say that there's no possible way to be lenient. The Shulchan Aruch says you can be lenient maybe on the 2nd day onwards, but hefsek Tara and day 1, there's no way to be lenient. It has to be an internal, deep rigor bedika. And the Noda B'Yehuda, nevertheless, goes one step to be more lenient. And he says that there are many authorities and proofs from the different Rishonim that say that we can be very makel. Nevertheless, we can't be more makel than hefsek tara and bedika yom rishon. So if you're talking about an internal bedika can be on, if you don't do an internal bedika, but only wipes, external wipes on days 2 and onwards, that's okay. But Yavad, it's okay. But Hefsek and Yom Rishon can't be. And he quotes the Ramban that said, you know what, even Yom Rishon, even the first day doesn't need. Only Hefsek, internal, and all the rest, a wipe, that's okay. A similar question was asked by the Divrei Atzi of the Kloisenberg Rav. And the question was a kala, and she was preparing for her wedding for 7 clean days. Nevertheless, just before the wedding, she's realized that she was taught wrong and she hasn't done any internal bedikas and only external wipes. Is that okay? Can we rely in such a shat adchak, in such a time of need, can we rely on a lenient opinion that would allow that to be counted as a hefsek and bedikot? And the Divrei Atziv goes into the different opinions. He quotes the Nodab Yehuda that we've just mentioned, and he says that B'dikot kinuach lekule alma lo mehani. Even if you go as lenient as possible, following the Ramban that the Nodab Yehuda quotes, that's only for the 7 days. But the hefsek must be an internal bedika. And gam bekala ze me'akev b'diavad lechol hadeot. There's no one to rely on, says the Divrei Atziv, to allow this kala to have an external bedika as a hefsek tara, and there's nothing we can do. She will have a chupat nida and become tahor later on. Barul halacha, that's how he concludes. Lema'aseh, the kinuach be'alma lo mehani. There's no way one can rely on a external wipe as a hefsek tara. Nevertheless, if one looks to the wording of the Rambam, the wording he uses that the eid bedika that the woman has is this clean cloth, and this is what she uses, shemekanachat bo, that what she uses to wipe herself, that is her ed bedika, that's her cloth. And if you explain that literally, that means that the bedikot and the hefsek as well that the woman uses is only a kinuach, only an external bedika. Obviously, one can argue that what he says, kinuach, it means an internal bedika, but that's not the terminology he uses. Obviously, the Gemara does not say an internal bedika. The Gemara says bedikot, but the terminology is mekanachat. There's no chorim mustakim. There's no deep internal bedika like the Shulchan Aruch says, just mekanachat. The common understanding is that the Rambam as well requires internal bedikot. But Rav Ratzabi, one of the important Yemenite poskim who follow Rambam, usually as a practical halacha, some part of the Yemenite Jews don't follow Shulchan Aruch, rather than Rambam. He holds that the Rambam is literally an external wipe, and there's no need more than that. So even though, again, Shulchan Aruch, Ramah, Nodab Yehuda, Ramban, all the halachic authorities of Divrei Atziv and others we've mentioned would not allow relying on an external wipe, at least not for a hefsek tara. There is such an opinion, and when there's a valid opinion, one can rely on the Rav Ratzavi and the Rambam. Maybe in extreme cases, one can consider that as an option to rely. And again, each case based on its own merits, and that's the great joy we have here at PUAH. Questions we get, have to analyze them medically, analyze them halachically, and find the right answer to the right people. And I was happy to share with you just a tiny bit of what we do here and the special COVID-19 questions we get. It was nice being with you. Good evening.
Thank you very much, Rabbi Lewis, for that enlightening presentation. I think that you successfully showed everybody who's with us this evening the complexity and the breadth of the questions that we have had to face in the past almost a year. And Bezrat Hashem, when this whole time is over, these will be learnt as test cases for such unusual circumstances. And thank you very much for presenting. He's got to give this one. The PUAH Institute was established over 30 years ago. Very simple and humble beginnings, but has grown to be a worldwide center, fielding questions for couples, for doctors, for rabbis, rebbitzins, for the public, on all areas dealing with fertility, with gynecology, reproductive health, male reproductive health, adolescence, intimacy, genetics, and many, many more. In order to show you a little bit of a taste of what PUAH does, we want to share with you a few minutes of a short video, a little bit describing the Machon, that you'll get a little bit of a feel of what it's like to work in the Machon, what it's like to be helped by the Machon, and what Machon PUAH stands for in the Jewish world. Thank you. Good evening. Welcome to the next session. We'll be hearing from Dr. Stephen Reinhold. Dr. Stephen Reinhold is a pediatrician. He's the preventive health officer, medical officer in Jerusalem, and he's also a medical administrator for Kupat Cholim Muhedet, and also a board member for the Israeli Ambulatory Pediatrics Association. He also has many skills. First of all, he's a good friend of mine. We're neighbors. And he also was instrumental in founding and maintaining in Modi'in a wonderful and I think unique meeting in which we meet regularly doctors and rabbis to discuss medical and halachic issues. And it's been extremely fruitful in the work, in the professional work, both of the rabbis and of the doctors. So I would like to publicly thank him for that. And without any further ado, we'll hear from Dr. Reinhold. There is a particular type of virus, which you'll hear about, HPV, which you'll hear the ramifications, and of course it's to be prevented. And the amazing bracha, the amazing blessing that we have in our generation is that HaKadosh Baruch Hu has given us the knowledge and the ability to eradicate things which really are fatal, and it's really an incredible blessing. And we will hear exactly what is the problem and what is the solution. We'll hear from Dr. Reinhold. Thank you very much.
Thank you very much, Rabbi Weissman. It's an honor to be here with you. You have been a friend, colleague, and rabbi to me for many, many years. And thank you for always attending our sessions here in Modi'in. It's a pleasure to be doing this with you again. Everyone, it's nice to be with you today. We're going to be talking about HPV, human papillomavirus. We're going to talk about what this virus is, the diseases that it causes, primarily cancer, and how we can prevent it. Okay. There's a lot of material that we can speak about. I hope I'll be able to share with you the most important points. There's a lot of information we could give, and I hope I will be able to share with you everything that is most important to know regarding this virus and our ability to prevent it. So human papillomavirus, okay? This virus is, let's show the diseases that it causes. This virus is notoriously known for causing cervical cancer, but it doesn't only cause cervical cancer. It's also responsible for many other cancers, also responsible for causing genital warts, but that's probably less of a concern right now. Right now, I would like to focus more on the cancer. It's involved for vaginal and vulvar cancers, anal cancers, penile cancers. And what is maybe most interesting recently is how much we see that it's involved in oropharyngeal cancers as well. In the past, smoking has been the most predisposing factor for oropharyngeal cancers. Now we know that it's HPV actually has become the #1 predisposing factor. That's very interesting, and now this is all, of course, a lot of this is very preventable. In terms of worldwide effect, how much cancer we actually have due to HPV. So if we look at the top of the pyramid, we see those cancers that are maybe less common, penile cancers, vulvar or vaginal cancers, but then we move on to anal cancers, and then oropharyngeal, which has a preponderance more so for men, 4 times as many as they have for women. Cervical cancer, which affects 500,000 women in the world, 500,000 women worldwide every year. Is one of the leading causes of cancer in women. Now, beneath the lines of cervical cancer, we have 2 more lines of high-grade cervical dysplasia, low-grade cervical dysplasia, and those combined are over 30 million women. Now, those 2 lines are referring to precancerous lesions. So we talk about preventing cancer. We don't only speak about preventing cancer or preventing death from cancer. We also need to look at all the people that have precancerous lesions and also go through multiple medical procedures, tremendous morbidity that is involved in people that have early stages or precancerous stages as well. We're moving into the tens of millions of women as well. At the bottom of the screens, it brings up genital warts, which also is a disease we'd like to prevent, but probably not as critical. We're more concerned of the cancerous ones. Obviously, they are far more invasive, far more morbid, and obviously carry a rate of mortality. So in terms of mortality, we talk about how dangerous are these cancers. So there are about 200 cases of invasive cervical cancer each year in Israel, and approximately 100 women a year pass away because of cervical cancer. In terms of, as I said before, when we look at cancer, we have to think also about precancerous lesions. There are another 5,000 women that are diagnosed each year with precancerous lesions. Oropharyngeal cancer affects about 100 a year, anal cancer, and genital warts, again, a large number of the population. So the toll that it takes on society is pretty serious. The suffering is considerable. In addition, one of my colleagues who was speaking today, Dr. Bornstein, who actually taught me in the past, he's giving this lecture in Hebrew. He's in this study where they discovered and reviewed the effect that HPV can have on male fertility as well. So the effects we're learning more and more. The advantage of prevention, the benefits of prevention are actually growing, and we're learning more and more over the years of using the vaccine, how many more diseases, how many more issues we're able to prevent. Now, how is HPV transmitted? Okay, so it is transmitted through intimate contact, okay? But it's not only intercourse. Various manners of intimate contact can cause the virus to be transferred. It's very easily transferred, and usually within the first year of intimate contact, even with the first moments, it can be transferred right away. The reason why this is important is because once a person is infected with HPV, what happens, if you look on the left side of the screen at the bottom, let's look at the picture. It describes this very well. You see oval, calm cells in the cervix. Over time, after the infection, those cells start to change. The red dot in the middle is the nucleus where the DNA is. That starts to grow more angry. The DNA becomes more active. The cells start to replicate at a number they're not supposed to, and they start acting and behaving and growing abnormally, which is characteristic of cancer. And over the course of years, the HPV infection leads to precancer and eventually cancerous lesions over time. Now, the virus can lay dormant for decades. Someone can have normal cells for years with the virus sitting very quietly for decades, and then these changes can happen over time. Typically, that happens over 5, 10 years, but it can be 20, 30, 40 years as well. This is showing the same thing. If you look at per age, if we're talking about, jumping ahead a little bit, mentioning vaccination, but vaccination can occur already from age 10. We're talking about the age of exposure to HPV usually happens by the age of 20, reach a peak, and then all the changes start developing thereafter. So if we're talking about prevention, we have to prevent before the virus infects. This is a very novel idea regarding infection, regarding cancer in general. Because usually when we vaccinate against infectious diseases, we're worried about the acute illness that somebody has. And this is going on right now with COVID. This happens with every other disease we vaccinate people for. But when we're talking about HPV, we're talking about something very different. The actual infection that a person has is not as worrisome. That lasts for about a year. Most of the time it clears. It's not terribly concerning. The problem is later on that can cause cancer. And this is a vaccine that is created to prevent cancer that can develop decades later if we don't do the preventive procedures beforehand of vaccinating before exposure. And what's novel here is knowing that a virus can transform the cells into cancerous cells, and therefore treating beforehand, preventing, giving a vaccine can prevent cancer later on in life. Now, how do we prevent? Okay, so this slide was actually made in Hebrew first. That's why it reads from right to left with primary on the right and secondary on the left, but I left it this way on purpose. Right now, the way we deal with HPV disease is the only thing we can prevent is cervical cancer. The others, when they present, there's no way to screen. Cervical cancer is really the only one we can screen for, and that's why women go for pap smears. All we have today for someone who has not been vaccinated is secondary prevention. Once they're infected, we try to catch the progression to cancer in an early stage so that we can be less invasive, so that we can treat at an earlier stage would be less difficult. However, as you saw all the statistics before, we only do that with mild success. There's a limit to how much you can prevent a process that's already started, how much you can detect all the cases, how much compliance you have with patients coming for regular screening. Therefore, despite the ability to perform Pap tests, and in order to be able to screen and maybe detect early and try to treat early, it's far better to prevent the infection in the first place, so that all this hopefully wouldn't even be necessary at one point. Going through all this testing by itself is very invasive. The precancerous lesions, what has to be done once a person finds these lesions, is also very difficult, more so the cancer itself, which we can't prevent them all, unless we vaccinate. And therefore we have primary prevention, and that's why the vaccine was developed. Now, there are various types of HPV. On the left side, we have the high-risk types that can cause cancer. On the right, we have the lower-risk types that cause warts. We're more concerned of those on the left side, and therefore the vaccines were created to prevent primarily mostly against the cancerous ones, but also against some of those that can cause warts. Now, Cervarix is a vaccine that has type 16 and 18, which are cancerous types. Gardasil added also 6 and 11, which cause warts, and those cause like most of the cancers and most of the warts. However, now we have Gardasil 9, which added 5 more types of the HPV virus to the vaccine, and that's able to prevent what we will see right now. In this slide, we're able to see how many of the cancers it's able to prevent. Now, most of the slide is in Hebrew, I apologize, but if you look above all the tables there, you see the names in Hebrew and English of all the different types of cancer that we can prevent and to what degree. We're talking about 90% of cervical cancer, vulval cancer, almost 90% of vaginal, almost all of anal cancer, oropharyngeal getting 90%, penile as well. Okay, and in terms of high-grade and low-grade precancerous lesions, we're talking about either 80 or 50%. And what's very interesting also in addition, even if we vaccinate against the strains that I showed here, there are other strains. And some data is actually showing that there's cross-coverage over other strains as well. So whereas in theory, all these are covered, in likelihood, even more strains are covered because of cross-reaction with other strains. And if I'm protected against 5 strains, probably I'm covered against 6 or 7 as well because they're so similar. Now, the vaccines themselves, we talk a lot about how vaccines are created these days with all the coronavirus vaccines, but let's talk about the one for HPV. Now, if you look at this picture here, you have a pink virus there sitting there, and on the pink virus, there's one specific molecule that is like its Achilles heel. Okay, that's where the virus attaches to another cell and is able to insert its DNA into a human cell. If we're able to attack that one part and disable that, that's it, we disable the whole virus. So that's what you do. You take that one part from all the viruses you want to vaccinate for, you put it into a vaccine, you purify, you make it safe, and you inject it. The body knows how to make the immune response against that one part, knows how to hit the Achilles heel of this virus, and is able to neutralize it and prevent the infection. So all this information is from the CDC website. It's very similar to other vaccines like the hepatitis B vaccine, the whooping cough vaccine, the pneumococcal vaccine. Very safe to use because you're only talking about specific particles. It's not a whole virus. There is no DNA material. There's no genetic material involved. Very safe, very effective. When do we vaccinate? So that depends a little bit on the age. Now, interestingly enough, I said before, we have to vaccinate before any exposure. So in terms of exposure throughout the world, so the vaccine was recommended for already from 9 years of age. Generally, it's given closer to 12, 13 years of age in order to give the vaccine before any exposure to HPV. However, it was also realized that the age also may affect efficacy. So if you give it before 15 years of age, only 2 doses are needed because the immune response is stronger, it's better, it's more effective. If you give it after 15 years of age, 3 doses are necessary. On the left side of the schedule, if 2 doses are given, it's given on the day it's given and 6 months later. And the same thing if you're given afterwards, but there's also another dose given at the 2-month mark. In terms of efficacy, if we, in terms of age and when people should be vaccinated, so in pink, we have girls that are vaccinated between ages 9 and 14. And in blue, we have women who are vaccinated between 16 and 26 years of age. And if you see the 2 doses given at the younger age lead to higher bars on the graph, which means they have greater antibody numbers, they have greater immunity, and it's more effective. Therefore, the recommendation is to vaccinate at a younger age because the vaccine is more effective at the younger age. These are the recommendations in the website of Misrad Habriyut. Now, whereas one hand we're concerned about prior to exposure, on the other hand, in any case, giving it prior to 15, as we said, is far more effective and therefore is recommended. Now, when we vaccinate at a young age, we vaccinated children who are 9, 10, 11, 12, 13, 14, even 15 years of age, question comes up, why we vaccinated a child for what is considered a sexually transmitted virus? It's transmitted through intimate contact. We assume that children that age, especially in certain populations, would not be involved in such behavior. And we're concerned that if we vaccinate them, we may be telling these children, hey, maybe giving a green light for certain behavior. Now, realize, I said before, remember I said before, the efficacy is greater if we give it at that age. So in terms of giving the vaccine for its effect, certainly we should give it at that age. The question just comes up, what message are we giving children? Now, in terms of surveys that were given to youth, to adolescents, at these ages, when they were given the vaccine, showed that it has absolutely no effect on their influence on first sexual encounter, the age of contact for the first time, or the number of partners. That the teenagers do not see this as a permit for any activity. They see this as a health issue, as a way to prevent cancer, and nothing more than that. Many surveys have been done. This is the survey done in Canada over the course of 10 years since they were using it. It does not affect behavior, and children do not see it that way. They see it very simply as a way to cause cancer. However, what do you do after those ages? What do you do for the older ages? Now, it's licensed generally from 9 to 26 years of age. As I said, it's better to give it earlier. What about over 26 years of age? In certain situations, you can give it. It actually is recommended that patient have a discussion with their physician to decide that if it's appropriate. However, if a person was already exposed to the virus, the vaccine is not going to be effective. Coverage, very important how much we cover. However, two things on this slide. First of all, we see that vaccine coverage rates. Israel has very good vaccination coverage rates. The first two syringes are the tetanus, diphtheria, and pertussis vaccine that's given at 2nd grade and at 8th grade. You see we have about 95% compliance in Israel, which, by the way, very proud of that because those are wonderful numbers compared to vaccination rates worldwide. And the HPV vaccine is given at the same time as the Tdap vaccine is given in 8th grade. However, the compliance is only about 58% across Israel. And if you look according to different regions, will also see variations. Sorry about that. See variations in different regions of compliance. Now, question is, should we give to boys and girls or should we give only to girls? This question comes up very often. So in this slide, if you look at the left side, we look at if we have, let's say, 40% of people vaccinate, okay, and we vaccinate only women, that's all the way on the left side, then we're talking about a reduction only of 36% in male diseases and 53% in women diseases. If we vaccinate men and women, both of them at 40% vaccination rate, we reduce male and female pathology at 71%. So when we vaccinate men and women together, the effect is much greater. And if you look at the right side, we'd say if we have better vaccination rates at 80%, then we're able to reach almost 100%, but only when we vaccinate men and women, not if we vaccinate only women. It's because, first of all, there is plenty of pathology that occurs to men, especially when we're talking about oropharyngeal cancers. We're talking about also fertility rates. And in addition, this is a contagious disease, and therefore we have to vaccinate from all sources. Safety is tremendously safe. The World Health Organization has reviewed since 2006. They've sat down several times already to review the issue of safety for the Gardasil vaccine, and it's been considered safe in terms of, here we go back to coverage rates. I'm sorry, going back and forth a little bit here. I wanted to show this slide earlier. In terms of coverage rates, if we look at different places in the country, the average rate I told you was about 58.8% for the first dose, 48.8% for the second dose. Higher rates in the north of the country, lower rates around Yerushalayim because of decisions made by certain populations because they felt like it was or not appropriate. Big issue as far as vaccinating in schools as well. But this is one of the issues that we want to address today. And addressing the situation, PUAH actually came out with a position paper that actually supports vaccination with HPV. And one of the reasons why that we're here to discuss this today, feel free to look at this on the website and to read it. It's very important. I've actually added this onto the website of the Israel Ambulatory Pediatric Association for physicians to use with their patients. Worldwide, how efficacious this vaccine is, and in terms of the need and how important this is, So the World Health Organization recently has developed a protocol. They want to try to eradicate cervical cancer worldwide. This actually is possible because we saw very good vaccination rates where you can get to almost 100% eradication. So if you do this for a few years, you could actually pretty much eradicate the disease. The question is, can we do that? Now, for us, our purposes, I mean, we're looking at this more as an individual level or a community level or as a national level. WHO is looking at this as a worldwide level, but the fact that we can actually talk about eliminating a type of cancer is actually amazing, mind-boggling, and thank God we have the ability to do this, and that Hashem has given us the ability and the insight and able to do such things. So this is actually the worldwide commitment, what they would like to do in order to eliminate cancer, and I hope that, well, we will be able to do so. So I thank you very much for listening. I'm open to any questions if anybody has. I'm going to take off the share screen. Okay, and I'm open to questions. I think Rav Weitzman, if you have any questions to me you'd like to ask, I'd be more than happy to answer them. Just a couple of points that I want to just bring up. There were a lot of questions brought up in terms of if we should vaccinate everyone and should we do it at a young age. And I just like to reiterate just one point here. The point of this vaccine is to reduce cancer. HPV disease exists in all communities. It occurs also in the religious community. Fortunately, there isn't always enough awareness of it. It's hard to really know exactly how much there is, but there definitely is. Therefore, our ability in order to eliminate it is extremely important. The issue of age, I feel that if we attach the vaccine to a regular vaccine schedule, and with the DTaP vaccine given at 8th grade, we're able to vaccinate, and we give the HPV as well, there's not much of a discussion. No one's really asking much about it. It's a routine vaccine, and there's only one more visit. If we delay the vaccine, there are 3 more visits, and then the conversation ensues. I think if we keep this as a shigra, as just a routine to prevent cancer, we could actually avoid a lot of the sensitive topics that often come up, but being able to yield a tremendous benefit. And I'm sorry, Rav Weitzman, if I may just share 2 brief stories. I'm sorry.
Of course, I'm very happy for you to.
I think you'll like these stories, and it may actually inspire more questions. So let me just, if you don't mind. 2 stories. One of them involves my son, my older son, I should say. He's already vaccinated. He's now 14 years old, but a couple of years ago, when he was due to vaccinate in school, my wife showed me in the WhatsApp group, the mothers were asking, are you going to vaccinate your son? And I asked my wife, I said, I didn't want to get involved and to push people online. I figured, you know what, I'll just do it in a pretty roundabout way. I asked my wife to actually write in my name to write, we are vaccinating our son, just like we vaccinated our older daughter. Gave a couple of websites for people to look up information, and obviously I'm available for questions. No one turned to me. My wife sent the message, that was the end of the discussion, and no one actually turned to me. Now, these people call me when they have any medical question. They know who I am, they've known me for years. Our kids are friends, they know how to call me. They'll show up on Shabbat if they have a question, not a question. However, this, not a word. Okay, what can you do? Yeah. My son comes home the day of the vaccination and tells me, Abba, they ran out of vaccines. And everyone's blaming me for getting a second jab in their arm because you told them they should vaccinate. Now, the reason why I mention this is we know that doctors have a tremendous influence on vaccination, on parents' decision to vaccinate. However, I do not think that rabbis and rabbaniyot have any less of an influence than doctors do. Sometimes they even have more of an influence. In many times in many communities, a doctor can't do anything until the Rav says it's okay or people confer. That's fine. But think about the effect you can have. Think about how important this conversation is and the influence you can have and the lives that can be saved. And this, I think, is very important. The second story is a little depressing. It's actually a friend of mine who's saying Kaddish for his mother right now. She passed away in the last year from cervical cancer. We're talking about someone who unfortunately was in the middle of those golden years when she was enjoying her grandchildren. Some were still just being born at this time. And unfortunately, after a year of a terrible fight, which she tried very, very hard with complications and trials with therapy, unfortunately, she succumbed to cancer and she passed away. This is a frum woman in a frum family. This is not some machala that we don't know about. This is something that affects our community and our homes and our friends and our family. This is something that we can't turn away from. And that's why I speak about it. That's why it's so important for me to be here, because I'm thinking about how can we save a life? How can we save someone in the future? And that's really where the focus is. Okay, Rav Weitzman, those are my two stories.
Dr. Reinhold, a pleasure as usual, and you were extremely comprehensive. I thank you very much. We have a couple of questions that came up. The first question was, can we vaccinate even younger? You're speaking about 8th grade. We're speaking about 9 years old, 2nd grade. Is it possible to vaccinate earlier? There are things that we're giving vaccination, to infants. Would it be possible to vaccinate earlier? So maybe you can fill that question.
So I know this question was asked. It's something that has to be investigated more. Can we vaccinate before 9 years of age? That's really the question. From 9 years of age, studies have been done. It's FDA approved. People can be vaccinated from 9. If we want to move before 9, then studies have to be done before we can change those guidelines. So in theory, I see yes. I don't see why. But keep in mind, we didn't know from the outset that there would be a difference of vaccinating before 15 years of age and after 15 years of age. So now the question is going to be, is there a difference between before and after 9 years of age? We have to know that about safety. In theory, it sounds reasonable, but we have to see if that's possible. So right now we can't do it, but it can be investigated in the future.
Another question that was asked was obviously from your presentation, as you said, your very comprehensive discussion and presentation. The question about somebody who's not going to be sexually active, a little bit related to the second very tragic story that you just related. Someone who is really a frum person, who's only going to have one partner, is there really a need to vaccinate them? That was the question that was asked, and I'd appreciate also if you able to.
So that's a very legitimate question. I mean, in theory, if someone has no intimate contact until they get married, or only with the person with whom they marry, and they're in a monogamous relationship their entire life, and there's no intimate contact with anyone else, you're right, then they wouldn't need it. But here's the problem, the catch-22. That decision has to be made before 15. So by the time we know the answer to that question, it's already too late. So we have to ask that question before we know the answer. Now, we want all our children, ourselves, to be yashar and do what we're supposed to do. Unfortunately, that doesn't always happen. And what if someone marries a choser b'tshuva that didn't vaccinate? Like, there are situations that are out of people's control. What about someone who did something without intending, or someone was put into a difficult situation, or things happen? Chas v'shalom, I wouldn't want this to be the price someone would have to pay. So to make that prediction beforehand is a very difficult decision to make. And I prefer going on the side of let's just protect them. And yeah, hopefully it would not have been necessary, but the vaccine is very safe. The safety profile is fantastic. In terms of side effects, I don't think I mentioned this, so I'll just put it in now. The side effects, local side effects, hurts a little on the arm, feeling a little something for a couple of days like any other vaccine. Some kids do actually faint, but they faint from other vaccines too. Very low rates, and it's considered tremendously safe. So I don't think there's really much risk in taking the vaccine. I think if anything, the risk would be it not. I mean, it's part of the health services in Israel. Kids get the vaccine for free. It's in the insurance of vaccine throughout the world. Most Western countries provide it for their citizens. So the issue would be to opt out, not to opt in. The default is to get it. So is it worthwhile not to get the vaccine is really the question that we need to ask. And there, I see no reason why not to.
You mentioned before, the PUAH position paper, we had the same question, and we came, I think, to a very similar conclusion, that there's a cluster effect of vaccinating. As we know, we don't know exactly what a person's going to happen in their life. And we presented that to many, many poskim, and they were also of the opinion that with the right education, that is something that should be done. And as you said, the ramifications of not vaccinating are worse, and that's similar to the vaccination we have at the moment with COVID-19, others that we're going to discuss, or we have been discussing this evening as well. So I want to thank Dr. Reinhold for a fascinating and a very comprehensive presentation, and I think a very convincing presentation. And I would also reiterate what you said, that everybody watching this, the professionals, be they rabbinic or medical, are often at a very, very important juncture, even though we don't always know that, we don't always mention it, and we don't see ourselves in that place. But we are really manhigei kila, we are people who are leading our communities, and people look to us to see what are we doing, even if they don't always ask, what are we doing, and that they will follow suit. So I appreciate it. And if we can eradicate an illness, and we can get to the point, as the Kadosh Baruch Hu promises, all the illnesses that Egypt suffered from, you will not suffer from. If one of them is HPV virus, then definitely the vaccination and the medical advances are something that will enable us to bring forth that blessing. So thank you very much and good evening. Good evening. Machon PUAH has been able to service the Jewish world for the past 30 years. And for the past 20 years or so, PUAH has also had offices in New York and a presence in Los Angeles and throughout North America, Canada, and even in South America. Several years ago, PUAH started hiring rabbis, local rabbis from America, and we have found that has changed completely the landscape of our ability to help couples in North America. And Baruch Hashem, a couple of years ago, Rabbi Ilan Sigelman came on board as our rabbi in New York, our senior rabbi in New York. Rabbi Sigelman is a rabbi of a shul in Queens. He was also taught in Landers College. He teaches in the medical school. And the Baruch Hashem, he has been able to help many, many couples through his work with PUAH, to also connect with many rabbanim, many important poskim, and also to connect with, of course, many great doctors and medical centers in New York. So good evening, Rabbi Sigelman.
Shalom Aleichem. It's a pleasure and an honor to be here.
And for us as well. So we said we'll have a little bit of a discussion for the next few minutes. And what I wanted to start with is tell us a little bit about why do we need PUAH in America?
Rabbi Weitzman, it's an excellent question. PUAH in America serves as a resource for so many women, for so many couples, for so many men, for so many members of the Jewish community. I'll just give you a basic background to what the services that PUAH offers here in America and where we are helpful and how we help so many people, Baruch Hashem, with Siyata Dishmaya. We have a number of programs throughout the year, and the purpose of these programs are to raise awareness of various fertility health issues, as well as remind the public what type of services we have. And I'll just list a few examples. We recently had a very successful webinar discussing the vaccine, the COVID-19 vaccine, and the effects and the ramifications it has with women's health. As we know, there are many rumors that are spreading about the safety of this vaccine. And we had Rabbi Dr. Aaron Glatt, as well as Dr. Eve Feinberg, both experts in the field of medicine, specifically in infectious disease, as well as fertility and the interplay between the two. And it was just the most fascinating and unbelievably well-attended event, which goes to show how much people are interested to hear what the experts say on these really cutting-edge medical issues. And PUAH is really at the forefront of these issues, supplying and providing this information to the public. We have, all throughout COVID, we've had webinars on different topics related to COVID, mikvah, and other areas of halacha, which people were so interested and so eager to learn more about. Shiurim on Shovavim, as the weeks of Shovavim with Parshas Shmos are among us here. Finally, we are in the weeks of Shmos, of Shovavim, so we have Shiurim and Hilchos Nida, and so many different topics of fertility to help the public. We also serve as a resource for Rabbanim. We serve as a resource for Rabbanim in many different ways. Almost every day we get calls from Rabbanim consulting us with different Nida Shailas or fertility Shailas. Just the other day I had the privilege and honor to speak to Rav David Cohen, who we speak to quite frequently, Rav Shmuel First from Chicago, Rashi Yeshiva from YU. I just got off the phone with Rabbi Sobolovsky from YU and Rabbi Willigan as well, and the Skolio Rebbe. This all just happened in like the past 24 hours. All had their different questions, all had their different issues that they wanted to discuss and that we had wanted to discuss with them. So as a resource for Rabbanim to call us to discuss the interplay between medicine and halacha is a very, very important resource that we're privileged to be able to provide to the rabbinic community. We have events for the Rabbanim. We had not too long ago a question and answer session with Rav David Cohen from Flatbush, addressing really sophisticated Nida Shailas. And it was also very well attended, and those who were not able to attend emailed for the recording, and it was spread all over the place. and we hope to continue this series of question and answers, addressing the questions from the Rabbanim with Rav Hershel Shechter, Rav Mordechai Willig, and the other Rabbanim, and that we found to be very helpful. We're also began a Taras Mishpacha hotline, and not only like PUAH in Israel has Rabbanim from the Machon, but we have some great Rabbanim who have agreed to answer on the hotline, to participate on the hotline, such as Rabbi Mordechai Willig, Rabbi Noach Isaac Olbaum, Rabbi Aryeh Leibowitz, Rabbi Sobolovsky. And that hotline doesn't just serve as a resource for the community, for the public with questions on Taras Mishpacha, but it should also serve as a resource for the Rabbanim. If the Rabbanim receive calls which they want to discuss the question with someone else, they can feel free to utilize the hotline as a resource for them as well. Let me just give another 2 minutes, if you will, about the resource that we serve for the community here in America. We get calls every single day, 24 hours a day, really, 7 days a week, 365. The phones are nonstop. And the questions range from basic questions, referrals. People are interested in going to a doctor. They want to know which doctor is in their insurance. Remember, the way it works in America is not the way it works in Israel. And it's not fully subsidized by the government. We have very, very expensive treatments. And sometimes it's of utter importance to have a connection with a PUAH, with a Rav who can connect you to a doctor, to give you discounted rates, to give you, really VIP service. And that's what we're able to do for our callers, our couples, our constituents, Baruch Hashem, as we have these wonderful relationships with the doctors, with the centers. People call about the beginning of their treatment, the very beginning. They have been married for a year or so, no pregnancy. Where do they take it from here? And we guide them. We guide them from the beginning until they have that healthy baby in their arms. But we also have questions when couples have tried certain techniques, they've tried certain treatments, but they haven't been successful. So when do they move on? At what point is it halachically and medically appropriate to move on from, let's say, a medicated cycle to something slightly more aggressive like an IUI? At what point do we leave IUI and we enter the world of IVF? And at what point in time do we actually consider leaving the world of IVF and enter the world of something slightly more complicated, that of third-party reproduction, namely surrogacy, egg donation, sperm donation? These are all very, very serious questions that we get day in and day out. And as I said in the beginning, it's an honor and a pleasure to be here. It's an honor and a pleasure to serve the Jewish community with all of these questions. And if you think it's over, it's not. There's more. We have people calling on a daily basis, single women who are inquiring about egg donation. What's the about egg freezing? Single women who are inquiring about egg freezing, fertility preservation. At what point is it appropriate to consider egg freezing? Where should they go? How much does it cost? Is there any financial assistance? These are questions that we receive every day. And unfortunately, we receive questions about pregnancy loss, not just about getting pregnant, but maintaining that healthy pregnancy. And sometimes women call about pregnancy loss, and that's often genetic. We end up having a discussion about genetics, and that's a whole nother world of science, of medicine that we're intimately familiar with, and that we're able to help guide people through their genetic issue, whether they're pregnant, whether they want to be pregnant, whether they are not even married yet and they're discussing premarital genetic issues, potential issues. These are all questions that come to the PUAH hotline here in America. And to answer your question, Rabbi Weitzman, why is it necessary? Because we're here to offer the most expert advice and information in the clearest, most appropriate and understandable method, with all of the support that is necessary. We have on staff a PUAH Cares team, which is a group of psychologists, of therapists, of social workers who are here to guide the couple through their journey, not just from a halachic and medical perspective. That's what the Rabbanim here help them do, but also from an emotional standpoint, to take them and hold their hand until the very end, until we can celebrate when they have a healthy baby, Baruch Hashem.
Wow, it sounds like you're very busy and you're doing a lot of things, which I know because I hear the whole time in our almost daily conversations about how much you are doing. You know that in Israel we have a whole system of supervision to ensure that there's no mistake in the lab, and I know you have also throughout North America and Canada and South America. Can you share me a little bit about how supervision works in America?
Absolutely. We have, as you mentioned, the supervision department, which is vast. To quote Rabbi Weitzman, it's a vast undertaking, a really major undertaking, and all of the credit goes to our head of supervisor, Mrs. Rivki Itzkowitz, who, and together with her assistant, Bracha Fried, they together are able to sometimes even in minutes' notice, they get calls from couples who are in need of supervision, and they're able to arrange that we have supervisors, and we have supervisors all over the country that are nashim tzidkaniyot, who are ready, willing, and able to drop what they're doing to go to a lab and do the supervision for a couple, for an egg freezing, for whatever it is. And sometimes people don't realize this, but sometimes they even have to be there by the lab in a hotel for an entire Shabbos, because there was one 15-minute check that needed to be done. So they sacrificed the Shabbos with their family to stay in a hotel to see to it that that couple, whoever they are, can have supervision according to halacha. We have, Baruch Hashem, thousands and thousands of calls, of treatments, of supervisions that we, Baruch Hashem, we're responsible for, that we oversee. And Baruch Hashem, we've only had hatzlacha. We haven't had any issues with our supervision. We are so fortunate and thankful to the supervision department, to the mashgichot, who tirelessly dedicate their lives for the couples, for the work here at PUAH. And we Bezrat Hashem, we hope to continue to supply and to provide and service the community with supervision in many more labs. As the science continues and develops, more labs are popping up. We're doing more and more supervision. So Baruch Hashem, it's a very exciting part of PUAH, something, a wing and division of PUAH that we're very proud of.
Wonderful. I don't want to keep too much time. It sounds like you're very busy. Maybe share with us this one story that rings through, and then you'll tell us a little bit how people can contact you, the rabbis that are listening here. So tell me maybe one story. Share with us.
I'll share with you two stories. One, because I'm so honored to be here for this kenis and to be part of the PUAH Israel's kenis. I'll share with you a story that I experienced a few years ago when I was on the route to Los Angeles. We were presenting in Los Angeles at a rabbinics conference, and I was coming from New York, and I think there was I think it was maybe you or Rabbi Papa coming from Eretz Yisrael. So we were going to meet at the shul that we were going to present. So as I was getting off the plane in Los Angeles, a fellow Jew turned to me and he said, "Are you going to this place?" And the truth is, I hadn't even been to Los Angeles ever before, and I didn't know where I was going, but I had an address. I knew exactly how I was going to get there, or someone was picking me up. I don't even remember. But I told him, "I'm sorry, I can't. I'm very crunched for time, and I don't have my own car. I'm sorry. I would love to help, but I simply cannot." And he said, "Well, where are you going?" I said, "I'm going to this place, this address, this shul, and I'm giving a lecture to rabbis." So he says, "Well, what topic? Where are you from? What organization are you a part of?" And I said, "I am from PUAH." I said, "Have you ever heard of PUAH?" And he looked at me and he said, "Have I ever heard of PUAH?" And this was in Hebrew. It was an Israeli fellow. He said, "Kol hayeladim sheli b'zchut PUAH." All of my children are because of PUAH. So that was one of the first exposures that I had, and I knew that it was such a special organization to work with. And just the other day, I got a phone call from a woman in Florida who I have been on the phone with for many hours. She had consulted me on many different things, this treatment, that treatment. And just the other day, she called me to tell me that she's Baruch Hashem expecting, and the words couldn't describe the gratitude that she had from Machon PUAH. And it wasn't because I'm a miracle worker or anything like that, but just the time, the patience, the advice that PUAH is able to give, we see results. And I think that's something so special about our organization, about PUAH, that we're able to see the results in real time. We see pregnancies, we see healthy children. And Rabbi Weizmann, I'm sure you can relate. There's nothing like holding a baby, knowing that Machon PUAH was able to help this couple have a baby. There's nothing like it. So it seems like a very basic and simple story, but it's a story that comes from the heart. It's something that really you have to be a part of it in order to really feel and experience it. And it's a tremendous chos to be part of this organization to help Klal Yisrael in such an important field.
Thank you very much. So the rabbis and the rebbitzins and the professionals that are listening, if they want to contact you or Rabbi Krohn or the PUAH care team or have supervision, how would they go about doing it? I know you're available. You said that 24 hours. Tell me a little bit about
24 hours.
All of you.
Yeah. When do I sleep? Okay. We'll talk about that at a different time. Next Kenneth, we'll have to discuss. But please feel free to come to our website, to visit our website, www.puahfertility.org. PUAH, P-U-A-H, fertility.org. You'll see the hotline number, email, contact information, our address. All of the information is there. I urge you to check out our website, see what our services are, see how you can get involved and how you can help. And I look forward to hearing from you, to seeing you, Be'ezrat Hashem, to meet with you. And in this chus of, I'm sure everyone is saying this, but in this chus of us coming together to bring more Jewish children to the world, taking all the neshamot shebeguf, we should be zocha to the binyan beis hamikdash b'mehera b'yameinu. Amen.
Amen. Rabbi Sigmund, thank you very much. Good evening. And
thank you for having me.
Keep up the wonderful work that you and Rabbi Krohn and the Leah Davidson and Mrs. Iskowitz and all the supervisors are doing. And we appreciate everything you're doing, the incredible dedication that you have, the tremendous amount of hours that you all invest, and the real belief. And it came over, I think, very much from your words and from the stories you told, your belief in the work that you're doing and the helping of Klal Yisrael. And anybody that's listening and has a question should know that Rabbi Siegerman and Rabbi Krohn and the whole team are available and are very happy to help. And thank you very much. Good evening. Shalom.
Thank you. Kol tov, all the best.
Kol tov.
Good evening. I'm sure you will agree that this has been a very fascinating and successful session, very informative and hopefully very helpful in your professional capacity. One of the questions that we ask regularly as Rabbanim is, I'm going out with a girl and her brother has this problem. They offer me a shidduch and he has this problem. Or I know in my community, I know in my family, there are people that have a particular problem. And should I share or not share that information? What should I share if I am asked or not asked? Obviously, it's a very, very large question, and each specific case requires its own stuff. However, I wanted to share a little bit about the idea of some introduction, as it were, to the whole question about shidduchim and the sharing of information. The questions that we have are in relation to Lashon Hara, the Lo Tamod Adam Re'echa.
לא, זה לא רואה.
זה להשפיע מההתחלה, נעשה מההתחלה, למה לא עשיתי שיתוף?
לא עשיתי.
זה עכשיו, זה שיתוף?
עכשיו עשית?
זה אני מתחיל מחדש?
כן.
Good evening. Again, I'm sure you will agree this has been a very fascinating and very informative session. One of the questions that we asked as Rabbanim, as professionals, is the whole question about sharing information for Shidduchim, prior to Shidduchim. A girl calls me, she's been offered a young man, his brother has such and such problem. A young man tells me he's going out with a girl and he found out she has such and such problem. There's a problem in the family. I know there's a problem because I know the people in my community. What are we supposed to share and what are we supposed not to share? And of course, that's a very large question. Each particular case needs its own side. However, I wanted to share some sort of thought and some introduction to that whole question. And we're going to look at various different aspects of that question and look a little bit about how that bears out in genetics as well. The question is around several issues. Lashon Hara, speaking or not speaking, but also Lo Tamod Adam Re'echa. There's a worry, a concern that if I don't share this information, someone will suffer because of that. There's also a question of Mekach Ta'ut. We have to ask, who's the asker, who's the asking, and when is it done? What point of the shidduch? Again, a large amount of information, but we'll try to get through it as confidently as possible. The Torah tells us there's an Isur Ona'ah. We're not allowed to lie. And the Mishnah in Masechet Bava Metzia, it's also Nifsak Shulchan Aruch and Choshen Mishpat, says that we can't beautify something, we can't change a human being as a slave, or an animal, or food that we're selling, or any other item that we're selling. We have to be truthful. And the question that we have, this is taken from PUAH, which is a wonderful resource for Rabbanim, and also for doctors and professionals. The question that's asked is, what should we be sharing? So, I don't want to read every word, but we'll look at it reasonably quickly. The responsibility is on the person to find out. The person has to, before they get married, find out. We'll look a little bit about the Shulchan Aruch and how that relates at the moment. And a person should ask, but they should ask very specific questions. We should ask Tachliti, Mumukat, Toshmiral, we should be careful not to find out about many people at the same time. It should be very specific. It's very important when receiving information that we make a distinction between the truth of facts and the interpretation. So the Shulchan Aruch speaks about the Chavetz Chaim speaks about somebody whose the interpretations are not very smart. What's the truth? The truth is that it takes some time to think. They speak very slowly. That may not be that they have a problem. A man has a very high-pitched voice. That doesn't mean that he has a problem. A woman has a particular bent. She's a little heavy. That doesn't necessarily mean it's a problem, although it could be. So we have to link the distinction between the facts that we are presenting and the interpretation of that. That must mean that there's a problem. If in this woman's family there is one child that has a genetic abnormality, that is now that she has a genetic abnormality. That's those two ideas, the truth, the fact, and the interpretation do not apply with each other. It's also important to make a distinction, that as Rabbanim we do the whole time, between those things that are essential and those things that are important when you're going out, but may actually, in the fullness of time, not be that important. So let's talk a little bit about genetics. And the Chazal already said, says the Gemara, don't marry a woman who's sick. Don't marry a woman from a family that has nichvim. Nichvim seems to be epilepsy, or Matsurim. Matsurim is, we sometimes call it in English leprosy, Tza'at. Don't marry a person who comes from a family that is tainted. And the Gemara says, what does it mean tainted? 3 cases in that family happen. So we have 3 cases in the same family of a particular thing, that we can assume that there's a chance that they will pass it on. And Chazal knew that well before Mendel, well before the idea of passing on information, passing on genetic information. There's another very, very important thing to remember. And beyond the idea that genetics is a hereditary, it's something that we pass from generation to generation. So we know of recessive genetic abnormalities. We know of doisharim that check genetic abnormalities. There's another important idea to understand, and that's the idea of aneuploidy. Aneuploidy means a egg which is already likely to create an abnormal pregnancy. A pregnancy in which there is a genetic abnormality. That, as you see from this chart, increases with maternal age. The older the woman, the more likely there will be a child with a genetic abnormality. We know that because you probably all know that there's a greater chance of having a child with Down syndrome, with trisomy 21, as a woman gets older. So why that's important is because there are 2 different types of genetics. And I think it's a very, very important thing to understand. Again, we go back to the difference between facts and interpretation. Genetics, first of all, doesn't cause illnesses. Genetics is the buildup of our bodies, what we're going to look like, what traits we're going to have, what propensity illness we're going to have. There are 2 different types of genetic information which is important for us for this lecture. The first is that there is genetics which is inherited. So if I am a carrier of Tay-Sachs and my wife is a carrier of Tay-Sachs, that's a recessive genetic abnormality. There is a 25% chance that one of our children will have that genetic abnormality. So if I know that I have a recessive genetic abnormality, I don't want to marry a woman that has a recessive genetic abnormality because I may pass it on, or we may pass it on to their children. The aneuploidy and the other genetic abnormalities are de novo, are new. They are not hereditary. You don't inherit trisomy 21. Most trisomy 21 men are infertile. They can't pass it on to the next generation. And so we don't pass it on because you got it from your parent. It's a new genetic reality, very much related to maternal age, but not only. If you go back, you see that even a woman in her 20s has the chance, or in her 30s here, has a chance of having a child with a genetic abnormality that's again not hereditary. So we can ask the question, why is that important to us? So I know that in the family there is a genetic abnormality, but is it a hereditary or is it something to know for? If I know that in the family, the case we said before, she has a brother who's got trisomy 21, what is the chance of her having it? The answer is that in most cases it's not hereditary, and therefore she has as much chance as anybody else at her age. And that's very important to make that distinction. I think a lot of people don't understand that, and we don't notice that we talk about two different things when we talk about hereditary genetic abnormality and something that's new. So let's talk a little bit about what we should check. We know, of course, that there's prenatal test, there is a premarital, pre-shidduchim, we have Dorisharim and others, J-Street and others that will test the person before going out. That's for recessive genetic abnormalities. Well, what about something that's not recessive? What about something that is dominant? That it doesn't matter who you marry. What about something, again, that's a new idea? There's a lot to speak about. Again, we don't have time to cover all of the ideas, but just to understand that there's a myriad number of questions related. The Shulchan Aruch in Ibn Ezra number 10 says, someone marries a woman who has no mumin, she has a that's a Mekach Ta'ud. That's what we said before the beginning. A Mekach Ta'ud is that we thought I was buying one thing, I thought I was acquiring one thing, and that was something else. She does other mumin. So the Shulchan says a certain mumin that are kosel, and a certain thing that the Shulchan goes into, we don't go inside. What exactly the woman would have that would be considered to be permanent. However, comes the Raman says the following. If in that town there is a bathhouse, a public bathhouse, a public swimming pool, a feeling the Mimshah set there, anybody, then a person, even if they have found out once they got married that the woman has a very unsightly scar on her arm, or she has a problem, something that's very ugly on the rest of her body, then the shidduch is still good. Why? When people go to the bathhouse openly, when they go naked, they go openly during the daytime. When they only go when it's silent, when no one's around, when it's closed, when it's hidden. Then even something that's known can be with a person with letter. What's the concept? The concept is there are the following. If you could have found out, you could have sent your cousin, your mother, your sister to the bathhouse when this young woman is going to have a bath, and you could have seen if she has a womb or doesn't have a womb, and you didn't find out about it, that's your problem. But if you couldn't have found out about it, it was hidden, and then you find out, then you can say, well, that's not what I bargained for. So the Ramah saying a very, very important idea. We'll just finish the Ramah. We'll understand it. Woman has epilepsy. We just said that's one of the cases that the Gemara says you should not marry him. In Rulas Man Kavur, if it's on particular times, that's a hidden woman. Why? Because when she knows she's going to have an attack, she goes into a house and she doesn't let anybody come in. But if it can happen anytime, it's completely random, then it's impossible that she covered that up. What's the Ramah saying? That the Ramah is saying that you have a responsibility to go and find out. And if you didn't find out, and now you come and say, well, if I don't know, then you could have found out before. If you could have found out, and even if then you find she has a serious problem, and you didn't look into it, you can't say, had I known, I would have wanted it. And that's a very, very important principle that we need to also understand that sometimes people accept that there are problems with the other side, and they still are having to marry them, or they don't want to know. And now they come back, and we can say, well, if you didn't ask and you want to know, then don't ask, don't tell. We don't have to necessarily share that information. A person should, that was their responsibility. So what's considered Mekach Ta'ud? So Mekach Ta'ud, I think, it depends on the Chevra, it depends on the society, and it's also Mishaneh, it's also very transient. So something that, for example, you give the example that we just have, epilepsy. Epilepsy in the past was considered to be a terrible illness. Today, Baruch Hashem, we have medication for epilepsy. People who have epilepsy can have perfectly normal lives. And therefore, we can assume today that epilepsy is not one of those things in which we can say that it definitely is a Mekach Ta'ud. Genetic abnormalities. When Dorishin first started, the idea of having a genetic abnormality, being a carrier of a genetic abnormality, was considered so severe that all the poskim came out and said, you can't test because you're going to create more and more mishpachat anefim, more and more families that don't want to marry. But if we now know genetic information, and we know that being a carrier doesn't make you sick in most cases, being a carrier in most cases has no ramifications for your lifetime. Therefore, that now is not considered a mum, and therefore it doesn't make sense. So I think that when we say what is a mum, what is considered to be a something that is so severe, an abnormality that's so severe that the person, had they known, wouldn't want to marry, that is very dependent on your society. There's certain societies that are much more closed and are much more specific, want something much more perfect. And it also changes from time to time. It changes through history. What was considered to be normal 10 years ago may today be different and the opposite as well. And that's a very, very important thing to understand. That when I come to say, someone says to me, is that a problem in Shidduchim? I can't say what I think. I'm already old, I already married for many, many years, I have grandchildren. I'm already, what's important to me is maybe different to what's important to a new generation. And so we have to understand that that's the changes. However, there are things that are incredibly accepted that are problematic. A guy, I got a call once from somebody outside of Israel, and they said, Rabbi, we have a question. If a girl was born without a uterus, so when do you have to tell the young man before they get married? He said, without a uterus, that's a very serious thing. That's clearly a mekafil. He said, no, Rabbi, you don't understand. The engagement is tonight. And we don't, when should we tell exactly the young man? So the face that this monkey has now, that's the face that I have. What do you mean? This is something that everybody would agree is a mekafil. That's impossible. We had a case recently in the Machon that a couple came already married. And the man had a serious male fertility issue. He'd frozen sperm. He knew about it. He didn't share with his wife. When they came, one of the rabbis looked through their file and sort of made a comment about the freezing of the sperm. And he said, no, forget it. She said, what do you mean? Well, forget what? What is it talking about? Those are things that are so severe, we can say in all times, in all societies, that would be considered a mekafil. And so there are things that are so severe, like a woman not having uterus, or a man not having testicles, or not producing sperm, that is so severe that it would be safe to say that in every society at every time, that would be considered to be mekafil, not to change. And therefore you have to share that information. The Chafetz Chaim says the following: if a person is sick, the other side doesn't know because it's an internal problem, it's not an external problem, it could have been checked in the bathroom. If I tell you, that's not refused. If it's something that's internal, that there's no way you can check, like a genetic abnormality, then there's not the refused. Even if they are not asked. Said the Chafetz Chaim, if it's something that could not have been discovered, that is severe enough that if it would be discovered, it would be considered mekafil. Again, each case is specific. We're giving the principle, we're giving the idea. Then that's what the Chafetz Chaim does not lashon hara. In fact, the opposite would be the case. As the Chafetz Chaim says, continues, says the Chafetz Chaim, first of all, to check, is it really true? I heard once the person had, maybe they already got over it, maybe they were having different diagnosis. This wasn't true. Saturate more than it is already. I should only have the intention of the good of the other party. Not, this guy is never, maybe was in my class, he was horrible, he has a problem. No, I should care only what the other side of the will it be successful? If at the end of the day the couple are going to get married anyway, sometimes I shouldn't say anything. Sometimes it's better not to say. Because if I say something, and it will then be in the background, and every time I have an argument, it will come out again. You should not have married. The rabbi said you were no good. The rabbi said you have a genetic abnormality. Then I'm actually doing no good because they won't not get married, they'll get married and it will become just a source of arguments. So maybe sometimes I shouldn't say anything. Because there are Kodesh Shadechim. Says the Chafetz Chaim, that's all before they got married. But because even at the Shidduch, I saw the baby saying, I shouldn't say anything. He discovered it, because obviously he accepted it. So it says the Chafetz Chaim, it very much depends on when I'm being asked. If it's at a time in which, before the Shidduch, or after they've gone out and they haven't got engaged, or maybe they got engaged and get married, then it's appropriate. But if already it's at a point in which it's too late, they're already going to get married and it's not going to change anything, then I can say, that's it, they already made that decision. There's a fascinating Gemara Masechet Yevamot. The Gemara Masechet Yevamot in Daf Mem Hei Amud Aleph says the following. A man came before Rav, and he said, what would happen with the person whose father's not Jewish, his mother's Jewish? Is he kosher? And Rav said, yeah, it's kosher. So I'm like that. My father's a goy, and my mother's a Jew. Maybe I can marry your daughter. So he says, no, I'm not going to marry her. People will say, people will say that the camel dances in its own circle. I.e., what do you mean? If you think he's kasher, you should let him marry your daughter. So what does Rav say? Even if it was like Yeshua Benun, I wouldn't want to marry him. He's not a good guy. I don't want him. He's kasher, but I don't want him. So what should the guy do? Now we start. On the one hand, he can marry a Jew. He can't marry a non-Jew. But on the other hand, nobody wants to marry him. So what do he do? Amali Yahavi Yeshua Benun, Yahavi Ma'aru Havi. Achminavi says, Shimi Bar Chiyat Rav. If he was like Yeshua Benun, he wouldn't need you. He'd marry someone else. But he's not. ואף רב מתן מורה קפא להיתר, ואף רב יהודה מורה בלהיתר. לפי עתן רב יהודה said, what should you do? Zil etzmil, ina siva minach. Go somewhere or marry someone like you. I either marry someone else who's got the same problem, or go somewhere else. What's going to happen is going to go somewhere else. But the Ati, come in the Rabbah, Malay, or Gale, or the Siva. Says Rabbah, go somewhere else, Gale. Go to someone else. So Rav Yudah said, don't tell it, ignore it, can't hide it. And if not, marry someone like you. Rabbah said, go somewhere else. What's going to happen if you go somewhere else? So the Steipler says a very important principle. The Steipler says that getting married is not buying a car. Buying a car, buying an item, I want that item. So if you tell me the car's got no engine, I don't want a car with no engine. The whole point is I want an engine, I want that car. I'm not interested in that particular model. I'm interested in a car that can drive. So if I buy something that's inappropriate, let's make a car. But marriage is like, I don't marry a person because they have all the faculties. I marry a person because I'm attracted to them, because I'm drawn to them, because I want to spend my life with them. So the Spiker says sometimes in a marriage, if a person will already go out, a couple will go out, and they'll see already that they have a connection, they'll overcome some of the problems. Not a very, very severe organic problem, but something that could be serious. I'll give you a case, Mamash this morning that I had, Mamash, a consultation with a couple. Young couple, they just got married, or they got married a year ago, and they're starting to see they're not getting pregnant, and they did a treatment, and they have a very serious male fertility. And the couple's sitting there, and she's crying, and they're very upset. But I said, you love each other, and you'll go through this. Once your relationship is this strong, you get through it. If I had known before they got married, if before they were going out, and he would say, I have a male fertility problem, that's as severe as he had, I would probably tell her, that's not a good shit. But now you're married, that's already something else. Sometimes a couple is so together that even though they have a problem, able to overcome it, you have to think about that principle as well. We'll go through this quickly. The Pitei Tshuva says a very important item. Everybody speaks about the problem of Lashon Hara. But in Lashon says the Pitei Tshuva, the exact opposite. Avon Gadol is the something that's worse and even more common. Says the Pitei Tshuva. Everybody's worried about this person, they have a problem, what's going to happen to them? But I said the Pitei Tshuva, worried about that person is going to fall into the Pach. The person is going to be married to them, and he's going to wake up next day and say, my gosh, this is a terrible problem, why did nothing solve it? So we have to think about that as well. We know he's a terrible person. We have to think about that as well. So on the one hand, we have the desire not to overcome, not to lie, not to speak Lashon Hara, but we also have a problem that we have a person who's going to suffer, who may suffer greatly because of that. The thing that would be the best is to encourage the person to tell himself. It says it's better that you should tell me. I can help you, I can facilitate that conversation, but it's better that you should share that information. And that's what we generally should do. That it should be that the person who has the problem should share it. Let's give one or two examples and we'll close. Polycystic ovarian syndrome, not a very uncommon case. A woman has a polycystic ovaries. She can get pregnant, but there's a likelihood she will have irregular periods. She may have other symptoms. Is that something that should be shared? The answer is probably yes. The question is when. Let's imagine we have the question of, I don't want to lie, but on the other hand, not every situation needs to be shared exactly at the moment. It should be now, it should be later. Generally, we say in PUAH that if it's something that's an organic problem, like we're saying, a woman who we know is going to have a treatment, or a person who has a genetic abnormality who will definitely get treatment, then that should be known up front. But if it's something that is more complex, then a couple that isn't clear that it's a problem, the couple should go out, and after a third of the time that they go out before they get engaged, then they should share that information together, sometimes without guidance, how to share that information, what to say, etc. But in dental, we do have to tell information. And I think it's very important that a couple should build their lives on the basis of truth. We shouldn't have a secret that we are carrying, that we don't share with anybody else, that at the end of the day is still with us. That's very important. I met with a young man, that he was married, and he had a known genetic abnormality. He knew about it, and he didn't want to have children for the first year. And he came up the next year, don't want to have children again. Why? Because he knew that if they start having children, they'd have to do testing for the children. And he had to tell his wife about his condition that he never told them. That's not a good way to start a marriage. And so when we think of breakdown, we have on the one hand the issue of speaking Lashon Hara. We have to know the reality before we say it. On the other hand, we have the problem, the issue of ignoring someone, of letting someone suffer. So we have to know exactly what the situation is. And as the sister Lisa said, try to encourage them to tell themselves. And then if at the end of the day they should share, the information doesn't have to be at the beginning. It can be done during, as they're going out, you said after that. So that's, again, a very short introduction to a much longer question that requires specific answers to each case. But I thank you very much for your attention and for sharing us in this session. And we should only know good news. We should only be able to help many, many people. Shalom, shalom.
For many couples, becoming parents is a long and difficult journey. For some, it also involves difficult halachic questions. The consequences are life-changing. Will the couple be able to have their own healthy child? Will they ever become parents? Modern medicine has so much to offer, but sometimes that only adds to the confusion. Couples become lost in a maze of medical procedures, which are emotionally and physically taxing. This is where PUAH Institute comes in, combining cutting-edge medical knowledge, halachic expertise, deep sensitivity, and an insider's understanding of the medical system. PUAH helps couples find the right solution and provides expert guidance in a variety of areas. PUAH's experts have professional relationships with over 400 medical specialists from Israel and across the globe. They're up to date on the most advanced research and innovative treatments and are familiar with even the most unusual problems. This expertise leads to diagnoses and connections that save couples years of searching, pain, anguish, and a lot of money. PUAH Hotline answers 300 calls every day. PUAH holds training sessions for hundreds of professionals and rabbis. PUAH takes a leading role in groundbreaking medical halachic research and has offices all over the world. PUAH assists couples from all parts of Am Yisrael and undertakes cases that others consider hopeless. For a PUAH consultant, every case means a chance to help a couple bring new life into the world. The consultant will accompany the couple through every stage, sometimes for years, until that longed-for moment when they finally embrace a child of their own. Over the last 30 years, PUAH has helped some 100,000 children to come into the world. Some of them are already parents themselves. But no less important, PUAH has helped tens of thousands of people who had already lost hope to achieve their dreams and become parents.